Hello and welcome to Alive with Amanda. Today we're going to be talking about what to do if you get behind on your notes. Okay, this is like a clinician's worst nightmare. I know that notes can be very stressful for people. People have a lot of different feelings about notes. Some people feel they're not necessary. Some feel they should be really minimal. Some people put them on the back burner and they're like, I'm going to do them later, and then they pile up. I have always had the thought that the minute your notes start piling up, it doesn't go from one note to two notes. It exponentially grows. It goes from like one note to 20 notes to 50 notes. And I've seen people be really behind on their notes, both at agencies and in private practice. And it is almost impossible to catch up, especially because you're not just talking about notes. You're talking about intake notes, which tend to be longer. You're talking about progress notes. You're talking about any consultation notes that you have or any other types of notes that are coming up. Like if you have some communication with an outside provider, etc. You're talking about treatment plans. You're talking about treatment plan reviews. So you see, I'm like, I'm pleading with you. Like, it's not just progress notes, right? It's the whole continuity of care that gets pushed back when notes are not completed in a timely manner. And then that will create a lot of stress and anxiety for the clinician. So this isn't just a plug for AI Notes, for TherapyNotes' new platform or new feature, Therapy Fuel, but I do think that AI Notes will help, okay? Back in the day when I first started as a therapist, everything was paper notes. This was before Obamacare came out and basically said, like, everyone's got to go to electronic. I mean, every doctor I went to had paper charts, manila paper charts, the two prongs, your name, the year and your name, like the last three letters. Everybody remember that, right? Like that was everywhere. In the hospitals, they had big binders. It was not electronic. Then through Obamacare, it came out like, no, everything needs to be pushed online. For the most part, I don't know all the laws and rules around it, but like everybody moved to an electronic system, right? So I remember a lot of people, doctors, et cetera, complaining about this, right? Like they were used to the old system. They wanted paper charts. There were reasons why they liked paper charts, and people were really resistant to it. And now every single hospital is on an electronic health record. We use, obviously, TherapyNotes for our electronic health record. Almost every practice I know uses an electronic health record. Sure, some smaller practices may use paper charts, but there are acts like the Open Note Act, which is requiring people to have access to their notes. So I just think we've gotten away from not having an electronic health record. So that was like the first step. And now this is like the second step, right? The second step is going to be integrating AI at some level in your practice. Again, you don't have to do it in the same exact way that everybody's doing it. You can decide if you want to use the feature where it helps assist you write the note, but you're putting in the input, or if you want to use features like having a scribe. I could see the benefit of having a scribe right in that session. I also understand people's fear about people listening in on their sessions and where's that data going and what does that look like. And so whatever platform you are using for AI, you want to make sure it's HIPAA compliant. You want to make sure they're not selling the data, and you want to make sure that it's really following all the laws and ethics of our boards, right? And so then people have asked, like, aren't you worried? Aren't you this? Like, we are moving forward. We have moved forward with integrating AI note writing in our practice, including using scribing. Why? Because we want people to feel empowered to use technology as they see fit. And that if that will help them to complete their notes and reduce that administrative burden, we think that is important, right? Some people are fantastic at getting their notes done really fast. Some people struggle with, what do I write? And we played with it. We absolutely had more seasoned clinicians go in, use the tools, and then look at it and say, yes, this is what happened in the session. It takes out maybe some of the fluff, right? And then it puts in clear, concise understanding of what happened in the sessions. Now, our therapists absolutely go back and edit and make sure everything is accurate, that didn't add something, or there's not some context that, like, something was maybe taken out of context. So we are aware and conscious about how AI tools can be used to enhance note writing. And I just have come to the conclusion with it that instead of fighting the technology and not embracing it, that we're going to step forward and embrace technology to the extent that we can. I can tell you some ways, other ways we are doing that. But we are definitely doing that with note writing so that you don't get behind, right? We don't want our clinicians to get behind at caring therapists. And we don't want clinicians across the country, across the world getting behind on notes because it's almost impossible to catch up without stopping clients, not seeing anymore. So it's not that snowball effect and getting caught, like spending a whole day getting caught up. There's really not another way to do it. If you're really, really far behind setting goals, like every day I'm going to write X amount of notes. But again, you're having to write your old notes and your new notes. And so it can be really stressful. So I do want to take a moment to thank our sponsor, TherapyNotes, who did roll out a really awesome compliant AI notes, which is Therapy Fuel. Again, we've gotten great feedback on it. We are using it to its full capacity. We've allowed our clinicians to decide what level they want to use and if they want to use it at all. Some people, maybe they're confident in their notes and they're already getting them in quickly and on time and they're accurate, etc. They decide they don't want to use it. So that's the nice thing about TherapyNotes is it's really customizable to your own needs. So I highly recommend you check out TherapyNotes. So if you are behind on notes, you could use something like ChatGPT to say, like, I'm behind on 50 notes. How could I get these done within a 1 week period of time? Or you can literally just write all of your notes for the day and then write, again, 5 extra notes. Or I'm a fan of stopping all therapy sessions, spending a block of time doing your notes. It's hard to toggle back and forth. Like see 2 clients, write notes, see 2 clients, write notes for an hour, block off 4 hours or whatever amount of time you need in order to get caught up on your notes because I know how stressful that can be. And so I highly recommend that you look into tools that can help you stay on top of your notes so you're less stressed and you can give great clinical care to your clients. I hope this was helpful. I'll see you soon, everybody. Bye.